Really, the reason why I chose ULM was because I was from Louisiana and this is our state pharmacy school.
I feel that ULM does a superior job at educating pharmacists. They lay the basic groundwork academically so that they are able to graduate and pass their national exams and be ready to practice.
Our program has an extremely high pass rate on the national and state board exams. We maintain accreditation status with our accrediting body, and the other unique thing is that the ULM College of Pharmacy, both students and faculty, truly do become like a family. We keep in touch with our students after graduation, they keep in touch with us, and I think that is directly attributable to the relationships that we form with our students while they're in school.
Every single teacher really cares about, getting the curriculum across to you, doing everything they can to help you succeed.
And we have social events here on campus. We have crawfish boils, and we had a dance this year, other things like that, so it's really great.
The advanced pharmacy practice experience allows students to actually implement the principles and practices that they learned while they're in class. They will do rotations in a community pharmacy, in an institutional setting such as a hospital, other rotations in a hospital such as adult medicine, where they're actually rounding with the patient care team, helping to make decisions for patients. And then the type of experience they would have on my rotation is considered ambulatory care, in that the patients that they see are not in a medical setting. They're actually out in the community. There's only 2 students per faculty member. With the low student to teacher ratio, it gives the students more access to the preceptor, greater opportunity to ask questions, and it actually gives the students more time to personally interact with the patients and make more decisions on their own. My particular setting is at the Council on Aging, and so all of the people that my students see are older than 60 years old, and that's one that's not typically thought of as pharmacy practice. It allows them to develop more as not just a pharmacist, but also as someone who provides service to the community in a unique setting. Many times our advanced practice experiences actually lead students to jobs.
There was one block that I was able to go home and stay with my family and do a rotation at a compounding pharmacy, which actually led to a job for me.
My experience at ULM helped prepare me to be a nuclear pharmacist, in that academically it set the groundwork for what all pharmacists need to practice pharmacy, and then they offered an elective that first introduced me to nuclear pharmacy, and then the experiential rotation I got to experience it firsthand, and I knew it was where I wanted to be from there. In addition to the required courses that ULM teaches, they offer a wide array of electives for students that might be interested in different areas, such as immunizations, women's health. They offer a medical outreach program, and also the nuclear pharmacy elective.
There's actually a class offered where you will do research for credit, and then from there you can choose to, on your own time, participate, whether it be on the clinical side or the research side, and it gives you a look into drug development and really a whole nother aspect of pharmacy. Just a lot of different things that are different from how most people view pharmacy as, just the retail, counting pills and dispensing prescriptions.
Our time here really set us up as a class to go out into these workplaces and feel confident in what we had learned and using what we had learned. I feel like the education that I've received here has very well prepared me for what I'll face as a pharmacist in the future.